Welcome to Luck Scout Psychology. Have you ever had a weird, unwanted thought pop into your head? You know, the kind that makes you cringe a little? Maybe you imagined yourself tripping in public or saying something embarrassing. We all experience these intrusive thoughts from time to time. It's a normal part of the human experience. Our brains are wired to process a vast amount of information, and sometimes those thoughts take on a life of their own. These thoughts might be strange, unsettling, or even disturbing. But here's the important thing. Having these thoughts doesn't mean there's something wrong with you. Think of your mind like a computer with countless tabs open. Some tabs are useful and relevant to your current task, while others are just random pop-ups that you quickly close. Intrusive thoughts are like those pop-ups. They can be annoying, but they're generally harmless. We dismiss them, refocus on what we were doing, and move on with our day. For most people, these thoughts are fleeting and don't cause significant distress. They might be a little weird, but they don't control our lives. However, for some individuals, these intrusive thoughts become more frequent, more intense, and much harder to ignore. They can latch on to our fears and anxieties, growing into something bigger and more menacing. These thoughts can become so overwhelming that they start to interfere with daily life. This is where we cross the line from normal, everyday worries into the territory of obsessive-compulsive and related disorders. It's important to remember that even if you find yourself relating to some of the experiences we're about to discuss, it doesn't necessarily mean you have a disorder. Self-diagnosis can be misleading and potentially harmful. This video is meant to be informative and educational, providing a general overview of these complex conditions. If you have concerns about your mental health, please reach out to a qualified mental health professional for a proper evaluation and guidance. Obsessive-compulsive and related disorders are mental health conditions characterized by persistent, unwanted thoughts, images, or impulses, known as obsessions, that cause significant anxiety or distress. These obsessions are often accompanied by repetitive behaviors or mental acts, called compulsions, to reduce anxiety or prevent a feared outcome. Imagine feeling an overwhelming urge to wash your hands repeatedly, even though you know they're clean. These are just a couple of examples of how obsessions and compulsions can manifest in OCD and related disorders. It's important to note that these disorders exist on a spectrum, and the severity of symptoms can vary greatly from person to person. They are real, treatable medical conditions that deserve understanding, compassion, and effective intervention. Obsessive-compulsive and related disorders can significantly impact various aspects of an individual's life. The constant intrusion of obsessions and the need to engage in compulsions can be emotionally draining. Imagine the frustration of being unable to control your thoughts and behaviors. The good news is that effective treatments are available. Early intervention is crucial. Understanding these disorders and promoting access to quality care are essential steps in helping individuals reclaim their lives. Let's start by taking a closer look at obsessions, those unwanted thoughts that intrude upon a person's mind and cause significant distress. Imagine having a song stuck in your head, but instead, it's a disturbing thought you can't shake off. That's what it's like to experience obsessions in OCD. No matter how hard you try to ignore them, they keep coming back. These obsessions are not simply worries about everyday problems. They are persistent, intrusive, and deeply unsettling. Common themes include fear of contamination, harm, symmetry, and unwanted thoughts. The content varies, but the intense anxiety and distress are common. Individuals with OCD often know their obsessions are irrational. They recognize their thoughts are excessive and unreasonable. Despite this, they can't control these thoughts, feeling trapped. The more they try to suppress these thoughts, the stronger they become. Imagine trying to hold a beach ball underwater. The more you push it down, the more forcefully it pops back up. Obsessions behave similarly, resisting control. Compulsions come into play to cope with the anxiety. While compulsions provide temporary relief, they perpetuate the cycle of OCD. Faced with the relentless onslaught of obsessions, individuals with OCD often develop compulsions as a way to manage the anxiety and distress these thoughts provoke. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. These behaviors are often elaborate rituals that follow rigid rules and are intended to neutralize the anxiety, prevent a feared outcome, or somehow make things feel right. Common examples of compulsions include excessive cleaning and washing, checking behaviors like repeatedly checking locks or appliances, counting and ordering, seeking reassurance, and mental rituals like repeating phrases or praying. While these behaviors may provide temporary relief from anxiety, they are ultimately ineffective in the long run and can become quite time-consuming and disruptive to daily life. Imagine someone who washes their hands for hours on end, fearing contamination from germs. While the act of washing might provide a fleeting sense of control and relief, it does not address the underlying fear of contamination. In fact, it reinforces the obsession by strengthening the association between hand washing and anxiety reduction. This creates a vicious cycle where the individual feels compelled to engage in the compulsion more frequently and for longer durations to achieve the same level of relief. Compulsions can take many forms and may not always appear outwardly visible. Some individuals engage in mental compulsions, such as mentally reviewing conversations or events to ensure they haven't done something wrong, or mentally repeating specific words or phrases to ward off bad luck. These mental rituals, while less obvious than physical compulsions, can be just as time-consuming and debilitating, interfering with concentration, focus, and overall quality of life. To truly understand the nature of OCD, it's crucial to recognize the interconnectedness of obsessions and compulsions. They are not two separate entities, but rather two sides of the same coin, locked in a continuous loop that perpetuates the disorder. Obsessions fuel compulsions, and compulsions in turn reinforce obsessions, creating a vicious cycle that can be incredibly difficult to break free from. Imagine a swinging pendulum. Obsessions are like the initial force that sets the pendulum in motion, creating a surge of anxiety and distress. Compulsions, in an attempt to regain equilibrium, act as a counterforce, momentarily stopping the pendulum's swing. However, instead of bringing the pendulum to a complete stop, compulsions provide only temporary relief, allowing the pendulum to swing back with even greater force, triggering a more intense wave of obsessions. This cycle can continue indefinitely, with obsessions becoming more intrusive and compulsions becoming more elaborate and time-consuming. The individual becomes increasingly entangled in their rituals, dedicating more and more time and energy to managing their anxiety, often at the expense of other important aspects of their lives. This is why early intervention and effective treatment are so crucial in breaking the cycle of OCD and helping individuals regain control of their thoughts and behaviors. Imagine a snowball rolling down a hill, gathering more snow and momentum as it goes. That's what can happen with untreated OCD. The longer the cycle of obsessions and compulsions continues unchecked, the more ingrained these patterns become, making it increasingly challenging to overcome the disorder. Mirror, mirror on the wall body. Dysmorphic disorder is a condition where individuals become fixated on perceived flaws in their appearance. These flaws are often so minor that others barely notice them. But to someone with BDD, these imperfections become magnified, consuming their thoughts. They may spend hours scrutinizing their reflection, engaging in excessive grooming rituals. This preoccupation often leads to significant distress and impairment in daily functioning. Understanding BDD and promoting body positivity are crucial steps in supporting individuals. Hoarding disorder involves a persistent difficulty discarding possessions, regardless of their value. Imagine a home where every surface is covered in stacks of items, narrowing paths and turning rooms into storage units. The act of acquiring possessions brings comfort and security, but discarding them triggers intense anxiety and guilt. Cluttered living spaces pose health and safety hazards, and strained relationships with loved ones are common. Addressing hoarding disorder requires a compassionate approach, recognizing the complex emotional and cognitive factors involved. Living with body dysmorphic disorder, BDD, or hoarding disorder can significantly impact emotional well-being and quality of life. Individuals with BDD become fixated on perceived flaws, leading to social anxiety and avoidance. Hoarding disorder causes intense shame and embarrassment, leading to isolation and feelings of helplessness. These disorders affect not only the individual, but also their relationships with family and friends. Seeking professional help is essential for addressing these conditions and improving overall quality of life. Trichotillomania involves an irresistible urge to pull out hair driven by anxiety or stress. This behavior provides a sense of relief, similar to scratching an itch. Hair pulling can be done consciously or unconsciously, often resulting in noticeable hair loss. Individuals may go to great lengths to conceal their hair loss, perpetuating the cycle of the disorder. Understanding the underlying causes and developing healthy coping mechanisms are essential steps in managing trichotillomania. More than skin deep. Exploring the complexities of excoriation disorder. Excoriation disorder involves recurrent skin picking, resulting in lesions and scarring. This behavior is driven by anxiety or attempts to regulate overwhelming emotions. Skin picking can be triggered by stress, boredom, or anxiety, leading to significant physical and emotional impact. Individuals may avoid social situations and wear concealing clothing to hide the visible signs. Effective treatment involves addressing the underlying emotional factors and developing healthy coping mechanisms. Breaking free from body-focused repetitive behaviors, a path to recovery. Recovery from body-focused repetitive behaviors is possible with the right support and interventions. Therapy, particularly cognitive behavioral therapy, CBT, and habit reversal training, plays a crucial role. Medication can help manage underlying anxiety or depression. Lifestyle changes such as stress management techniques and engaging in enjoyable activities support recovery. Seeking help is a sign of strength, and with the right treatment, individuals can reclaim their lives. Retraining the brain, the power of cognitive behavioral therapy. CBT is an effective approach for treating obsessive-compulsive and related disorders. Exposure and response prevention, ERP, involves gradually facing fears and resisting compulsions. CBT helps challenge underlying beliefs and develop a more realistic view of oneself. It's a collaborative process, working closely with a therapist to set goals and track progress. CBT equips individuals with tools to manage symptoms and live a fuller life. Medication, particularly SSRIs, can help manage symptoms of OCD and related disorders. SSRIs increase serotonin levels, calming overactive brain circuits. Finding the right medication and dosage can be a trial-and-error process. Medication is most effective when used with therapy to address both biological and psychological aspects. The right combination of treatments allows individuals to reclaim their lives and thrive. Habit reversal training, or HRT, is a highly effective therapeutic approach for trichotillomania and excoriation. HRT focuses on breaking the cycle of these often unconscious behaviors. It involves increasing awareness of the behavior and developing competing responses. For example, using a stress ball or practicing deep breathing. Environmental control is also crucial. Relaxation techniques like mindfulness and meditation help manage triggers. HRT is a collaborative process requiring patience and support. With dedication, individuals can break free from these behaviors. Living with obsessive-compulsive and related disorders can often feel like an isolating experience. The secrecy and shame that often surround these conditions can make it difficult to reach out for help, leaving individuals feeling alone in their struggles. But it doesn't have to be this way. Support groups offer a lifeline of understanding, connection, and hope for individuals navigating the challenges of OCD and related disorders. Imagine walking into a room where you're surrounded by people who truly understand what you're going through, people who don't judge or dismiss your experiences, but instead offer empathy, encouragement, and practical advice. That's the power of a support group. It's a safe and confidential space where individuals can share their stories, connect with others who face similar challenges, and gain strength from one another's journeys. Support groups provide a sense of validation and hope, reminding individuals that they are not alone in their struggles. Hearing others share similar experiences can be incredibly validating, helping to reduce feelings of isolation and shame. It can also be incredibly empowering to realize that there are others who have successfully managed their conditions and are living full and meaningful lives. Beyond sharing experiences, Support groups also offer a platform for learning from one another. Members often share coping strategies, tips for managing triggers, and insights into navigating the ups and downs of living with these conditions. This exchange of information and support can be invaluable, providing practical tools and resources that individuals can implement in their own lives. Remember, you don't have to face these challenges alone. Support groups offer a lifeline of connection, understanding, and hope. Reaching out to others who understand can make a world of difference in your journey. While therapy and medication address the cognitive and biological aspects of obsessive-compulsive and related disorders, incorporating mindfulness and stress reduction techniques into your daily routine can provide an additional layer of support, helping you manage anxiety, reduce the intensity of obsessions and compulsions, and cultivate a greater sense of inner peace. Mindfulness is about paying attention to the present moment without judgment. It's about observing your thoughts, feelings, and sensations without getting swept away by them. When you practice mindfulness, you learn to become more aware of your thought patterns, recognize when you're getting caught up in obsessive thinking, and gently redirect your attention back to the present moment. There are many different ways to practice mindfulness, from formal meditation practices to simple everyday activities like mindful breathing, walking, or eating. The key is to find what works best for you and to incorporate it into your daily routine. Stress reduction techniques such as deep breathing exercises, progressive muscle relaxation, and yoga can also be incredibly helpful in managing the anxiety that often accompanies these conditions. These techniques work by calming the nervous system, reducing muscle tension, and promoting a sense of relaxation. Think of mindfulness and stress reduction techniques as tools in your toolkit for managing OCD and related disorders. They can help you create a sense of calm amidst the storm of obsessions and compulsions, empowering you to respond to those thoughts and urges with greater awareness and control. Reclaiming your life hope and healing for OCD and related disorders. We've explored the complexities of OCD and related disorders. There is hope, and recovery is possible. These conditions are not a sign of weakness. They are treatable medical conditions. Seeking professional help is crucial. Effective treatment often involves CBT and medication. Support groups and mindfulness practices help manage symptoms. You don't have to navigate this path alone. Reach out to trusted loved ones and professionals. With the right support, you can live a fuller life. You are not alone. Reach out for help today. There are resources available to support you. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.